Yeah, just a quick review of the Ace brand adjustable knee brace. So Ace has a reputation for making very simple, straightforward, basic yet effective braces. For like your wrist, your elbow. You can find these braces, like at Walmart, Target, that kind of thing. um, but anyway, this brace is made specifically for people that have some kind of knee problem or some kind of knee pain. And the idea here is that you put on this brace and it kind of supports the joint, surrounding soft tissues, and it restricts your knee motion a little bit. And that way your knee has a chance to rest, recover, and not get so overstressed as you do things. So it could be kind of a prevention thing as well. So a few points about this particular brace. It is made of perforated neoprene, so it's going to be pretty breathable. So if you do wear this a lot, especially people have a tendency to put these things on when they're being really active, like playing sports, or they're going to be outside doing yard work. Especially in the summer months, you're going to wear this thing all the time, especially during the day. You're going to sweat, and if the brace is going to pick up some of the sweat, after a while it's going to start to stink. So sooner or later you're going to have to worry about washing it. So it's best just to start out with a highly breathable fabric just from the start. And the other thing to know is that this is actually for the right or the left knee, so you don't have to worry about just do I buy a right one or a left one, which is good because you use for your right leg, and then down the road, hey, I don't need it anymore, and then further down the road, oh, my left knee's hurting or having trouble. You can always pop it on and use it for either knee, so that's really practical. Other things you can do if you have knee problems, I'm getting this from this one resource, Bulletproof Your Knee. If you have any kind of knee issue, you really need to do at least one exercise to strengthen your quadriceps muscle. Your quadriceps muscle is made of 4 different muscles, but they call it the quads. Your quads are on the top of your leg here, and there's your patella or your kneecap, just for reference. So just above that is your quadriceps. This is a big key muscle that stabilizes your knee. So most of the knee stability comes from your quadriceps muscle. So if you have weakness, you're compromising the stability. It's hard to get pain-free and get a fully functioning knee. What they're finding now, it's a selective problem. If you take people with various issues, like say, they tore their anterior cruciate ligament, and you test all the muscles around the knee, for some reason, the quadriceps takes the biggest hit. Usually they find either it's weaker than it should be, weaker than normal, or if you look at, they do CT scans, they look at cross-sectional area, it's smaller than normal. And this may be why knee swelling in the quadriceps. One study demonstrated that even if you have as little as 20 milliliters of fluid in your knee, which is just over a tablespoon, it's enough to decrease the strength of your quadriceps muscle. So if you've injured something or you have any kind of chronic knee swelling, makes your quadriceps weak. Knee injuries in the quadriceps, you have the history of, fracturing your tibia, your lower leg bone, for instance, or a surgical opening of the joint. If you had knee surgery, research go around, if they tested your knee, they probably find you have some weakness there. Ligament problems in the quadriceps, anterior cruciate ligament, ACL. Here's one study looked at people who had completely ruptured their ACL. They found that the strength of their quadriceps was injured, the injured leg was decreased by 25 to 30%. So that's a huge hit on the stability of your knee. It's hard to get pain-free if you don't have that good knee stability, so everything can kind of, rest and recover. It's kind of like the idea of the brace. The brace, provides external support so things can kind of like rest and recover. You have a strong quadriceps, that's like dynamic stability. Kind of like, an internal brace. Anyway, posterior cruciate ligament, same kind of thing. Medial collateral ligament, look at people with medial collateral ligament tears. They find, oh boy, the quadriceps strength, 21% quad deficit. I mean, that's significant. Knee pain in the quadriceps. You have chronic knee pain, puts you at risk to have decreased quadriceps strength. Here's a really interesting, knee arthritis in the quadriceps. So, tons of literature, actually, if you Google it, like knee arthritis and quadriceps strength. Just about every study showing that if you have knee arthritis, you probably have weak quads. Likewise, there are randomized controlled trials showing that if you take a group of people with knee arthritis and you strengthen just their quadriceps muscle, that their knee pain starts to go away. Even more interesting, they find that people with the strongest quads have the least progression of their knee arthritis. So having strong quads, you got a lot of reasons if you have knee arthritis. Patellar femoral pain syndrome. I mean, the list just goes on and on. So any kind of knee problem, from pain to, non-specific, issues, ruptures, definitely make sure that you're strengthening your quads. Fine-tune control over your knee. Here they're talking about your hip muscles. Sometimes you can have knee pain. It has nothing to do with anything going wrong in your knee, but actually there's a problem up at the hip. So classic case is iliotibial band syndrome. So if you take a bunch of people with iliotibial band syndrome, you test the muscles around their hips, they find that they have unusually weak hip abductors. So your hip abductors keeps your pelvis level as you're walking, also help to bring your leg out to your side. And here again, randomized controlled trials showing that if you take a group of people with iliotibial band syndrome, you strengthen just their hip abductors, the iliotibial band syndrome starts to go away. Isn't that interesting? Optimized knee flexibility. We all know you have to have a knee that bends and straightens fully. A lot of people don't know is that your knee actually rotates, okay? So about the last 10 to 15 degrees of you straightening your leg, your knee actually rotates laterally or out to the side. And here's a little test to see if you have that accessory motion, just by putting two little dots, and you can see how it rotates normally. So that's an accessory motion that you'll definitely want to have a fully functioning knee. Other things you can do, increase dynamic knee stability. Here they're talking about proprioception. So proprioception is your position sense. So if I suddenly turn the lights out now, you probably would be able to tell me if your knee was bent or straight. That's because you have these joint receptors, nerves in the joint, nerves around the soft tissue, that give your brain constant feedback as to where your knee is in space. And so you always know where your knee is without looking. Well, so when they take people with various knee problems, researchers are going around testing their proprioception, and they're finding that is decreased. So it's not like people with a certain knee problem, they don't know where their knee is. It's just not what it's supposed to be. So that impacts like your reaction time. Like if your position sense is off, like let's say you stepped off a curb, your knee suddenly is in a certain position. You have to know what positions that is so you can contract the muscles real quick. So that kind of stuff. But yeah, lots of stuff you can do if you know what to do. Hey, nothing's as quick and easy as slapping on a brace. It's a good thing to do if you have knee pain. So definitely check it out.